Can heavy implantation bleeding be a sign of a miscarriage?
Hello everyone. In this video, we're going to tackle a significant question many women ask about their early pregnancy signs. Can heavy implantation bleeding be a sign of a miscarriage? It's important to understand what implantation bleeding and a miscarriage are, and how they might be connected.
What is implantation bleeding?
Implantation bleeding is a form of spotting or light bleeding that some women might experience when the fertilized egg, or the embryo, attaches itself to the wall of the uterus. This usually happens about 6 to 12 days after conception. This bleeding tends to be quite light, often resembling a light period or even just a spot of blood. It's generally not as heavy or as long-lasting as a regular menstrual period.
What is a miscarriage?
A miscarriage refers to the loss of a pregnancy before the 20th week. It's often associated with symptoms such as heavy bleeding, often with clots, severe abdominal pain, and sometimes even the passing of tissue. Other symptoms can include back pain and a sudden decrease in signs of pregnancy.
Can heavy implantation bleeding indicate a miscarriage?
So, to answer the main question, heavy bleeding during the time of implantation could potentially be a sign of a miscarriage. But it's crucial to remember that every woman's body is different, and the intensity, duration, and type of bleeding can vary. However, if the bleeding is much heavier than usual, accompanied by severe cramping, or if you're feeling concerned, it is definitely recommended to seek immediate medical attention.
How can you distinguish between implantation bleeding and a miscarriage?
Distinguishing between implantation bleeding and a miscarriage might not be straightforward. If you experience bleeding during early pregnancy, it's vital to monitor the characteristics of the bleeding. Implantation bleeding is usually lighter, maybe pinkish or brownish, and does not last as long as a regular period. On the other hand, bleeding from a miscarriage tends to be heavier, similar to a period or heavier, and may come along with cramping, back pain, and the passing of tissue. However, even with these differences, it can still be challenging to make a definitive distinction on your own. Therefore, it's always best to consult with a healthcare professional if you have any concerns about bleeding during pregnancy. In conclusion, while heavy implantation bleeding could potentially be a sign of a miscarriage, it's important to remember that every woman's body is unique, and the type and amount of bleeding can vary. It's always the safest course of action to reach out to a healthcare provider if you're worried about any symptoms during pregnancy. We hope this video has been helpful in understanding the link between implantation bleeding and miscarriage.